Hello everyone, I'm Casey and we are Blueprint Minds and we're going to go over our product One Health Discover. First, I'm going to overview it. So, One Health Discover is a public healthcare system that is funded by a percentage of each citizen's income. This healthcare system was devised keeping people with low income, those living with a chronic condition, and anyone that needs to save money for the treatment they need in mind. When considering how we might make the ease of access to our service better, we thought a website service would be the most useful. In our website, we wanted to inform users of our service, streamline the process of getting the treatment they need, and establish a clear line of communication between the users and the people at One Health Discover. Next, we'll go with Alex on the opportunity statements.
So our initial opportunity statement was, how might we make healthcare more affordable for people with low income? After receiving feedback from our peers, we agreed that we were lacking a key aspect. Taking this into consideration, we revised our opportunity statement to, how might we make healthcare more affordable for people with low income without making services insufficient? And to understand how exactly we would do this, we looked into Germany's healthcare system. After receiving more feedback, we realized that we needed to attract more people to our healthcare system. With this, we came up with a redefined opportunity statement. How might we utilize technology to attract more users to our healthcare system? We created prototypes like the storyboard below and others, and got feedback from user testing and from demo day. And on to Jasim to talk about what we learned.
We decided to design a website that will fulfill all our user needs and provide the best user experience. We started with the fonts and the color palettes and assigned ourselves specific parts of the website to work on. Here are the initial prototypes we came up with. The first one on the left is the homepage. Second and third one make up the Find a Doctor page. The final one is the Contact Us page. Based on user feedback, we made changes to the color palette and opacity to improve on our design. Jared will go through the changes and iterations made in our finalized product.
From what we learned, we adjusted our website to fit our user needs. This is our homepage. We aimed for a warm and welcoming color palette and an easy to navigate website. This is our Find a Provider page. Here you can search for a specialist for the user's condition. Users can also view and write their own reviews for specialists. Here's our contact and locations page, where users can get in contact with us and find a One Health office near them. Here's our Find a Location page, which allows users to find the closest primary provider to them. And lastly, the About Us page, where users can read more about us, about what sets One Health Discover apart from other healthcare systems. But what makes us unique? Like said earlier, we got ideas from the Germany healthcare system, where every user pays the same percentage of their income regardless of how much they make. With that, there's only one copay for all services and no deductibles. So once receiving care, you'd pay nothing. The website allows users to leave reviews and providers. Low-income users will be able to receive sufficient healthcare. Long-term or chronic illness users will be able to receive healthcare that they need without going into medical debt. And now we'll go to Abdul for this important.
So, as everyone knows, healthcare is one of the most basic, important human necessities. Low-income users cannot afford good healthcare, and if they do, they're more likely to go into medical debt. So, our main goal of the system that we created is to eliminate this problem. Thank you so much for listening, and this was our project.